Top of the morning, guys. Mike Galbraith, family and sports medicine physician, and I have the pleasure of being joined by extraordinary physiotherapist
Brian Boehme, physiotherapist. I lead sports medicine.
Did you know we are officially the greatest sports medicine clinic south of the Mackenzie River?
Now I do.
Yes, now we do. That's on the map.
Excellent.
And I know you're a huge fan of using these fancy little exercise balls.
Big fan.
I was really excited to make this video because I can just bounce.
Well, that really helps for numerous reasons, but we're going to be more specific. We're going to show a couple different exercises today that has to do with some core strength. You're looking at getting benefits, say, for ankles, for knees, for hips, for back. It's going to be quite a few different things that we're going to benefit from.
So this is going to cure my body.
It'll be a good one to do that.
Good.
Yes.
Perfect.
And challenge you probably even more ways than that too.
Good.
So we're going to show you a couple things. I'm going to have Mike be my guinea pig. I'm going to walk through a couple things, and we'll see how good he is at this.
Sounds good.
All right.
I'm embarrassed.
All right. So Mike is going to get into a bridge position.
Okay.
Just like that. And he'll walk a little bit out this way with his head comfortably. There he goes. I'll oftentimes say to patients, let your head be comfortable. As you do this, and maybe I'll come down here closer so I can help support him in case he loses his balance. All right, that's the other reason why we have this table here. I'll oftentimes tell patients to do this close to something that's solid, like myself, to make sure that they're safe. Now, generally they're close to the ground, so if you start to fall, just sit your butt down.
How long do you want me here?
Well, this is the nice thing about it. I'm going to have this be a part of an endurance component. So for you to be in a bridge position right here, which you're already doing, your glutes are going to be fine right now.
They are.
Your back muscles are going to be fine right now. To stay level like this, which is what I want. This is what I'm talking about as far as that endurance component, because they have to stay fired. If all of a sudden you let your glutes relax, that's what tends to happen. You just you break that bridge, and I don't want to see that happen. I want to see you maintain that bridge position. Now, to make it a little harder, if you want to, and you don't have to have your hands right there. You can have your arms just like this, or they could have it be right here, because some patients are a little bit worried that they're going to be falling or losing their balance. So they just say, well, put your hands beside you then, and then as soon as you start to lose your balance, there you go.
Yeah.
You're
Maybe
right
I
there.
can just push myself up.
That's a good way. And I have had patients do that because if they feel their glutes kicking in with their hands, then generally they know they're staying pretty level. And that's one of the things I'll hound patients in this is make sure you stay level. If one glute isn't firing very well, you'll see just what Mike did. You'll twist and rotate a little bit, which we don't want.
Well, I can tell you, I'm pretty sure after sitting this bridge here about 10 minutes, my glutes are firing.
Fantastic.
Yes.
Good. To make it even tougher now,
oh boy,
I'm going to have him bring his feet closer together. And I mean closer together. There we go, good.
Ooh.
So now because he's decreased his base of support, it's going to make it even harder.
I feel like I'm going to fall over.
For a lot of patients, that's exactly what they'll say. I feel like I'm going to fall over. Mike being, a Raymond comic kind of guy, it's very common to see that. Now, I'm going to give him even more. I'm going to give him even more different exercises to make this even more complicated. So I'm going to get my assistant to throw a ball over.
Uh-oh.
This is a heavy ball. Okay. This has got some weight to it. So for that reason, it's going to throw his balance off as he does this. So he's going to grab that, and he's going to extend it to one side with one hand, which is going to force him to have to balance more.
Oh, that's right. You got to
and then he's going to do it. Now he's got to get the other side and reach over that way. He's got to really stabilize, which is a really good way to get all these different muscle groups firing. Quads are really firing good. Even his ankles, even the core perception. Yes, ask away.
I kind of want to switch roles right now.
Fantastic. Let's do it. All right. This is a tough exercise, but we got one more. Now, normally I wouldn't have him do all this in one setting, but because I'm going to really challenge him and challenge his manhood, we're going to keep him going. All right. This one it's a basketball. I got a lot of athletes that'll take this and just practice their shot. Now, once again, this has him focusing on something other than his balance. So that's why I have him do it, because it's going to make him more.
I'm going lefty.
It's going to make him challenge himself more as far as his balance and stability. Now, I'm washing my face here because knowing his shot is.
I was never good with the left.
Okay,
that's
so
right.
In this case, okay, perfect. All right, he's got to stay stable the whole time, bridge the whole time. Perfect. Now I'm going to have him come back up and take a second.
Can I sit?
There you go. Perfect. How was that?
Tiring.
You can see his face is almost the same color of his shirt. So he was working on that one. That's a tough one to do. There's one more that we're going to do that might be even harder.
Perfect.
But I'm going to give him a little break to catch his breath. Okay, we're good. All right,
now
so
I'm
now I'm
ready.
going to have you land your back right here.
Okay.
And your feet are going to be up on the ball.
Ooh, okay.
This is a
Head
tough
this
one.
way.
Head on this way, yep. Feet up on the ball there.
All right, get untangled here.
Now, it's still going to cause him, or going to challenge his balance, especially if he starts to, in this case, bridge up his butt a little bit.
So do you want heels up like that?
The heels just like that. I'm going to bring this a little bit further away from you.
Yeah.
Good, just like that. Now lift up your butt just a little bit off the table. Right there, good. Now you might want your arms on the floor.
I think
just
I
like
will.
that, because for a lot of patients, this is even a greater challenge than the other version. But this one's really going to focus more on his hamstrings. And for lots of patients that have had a knee surgery, their hamstrings don't fire very well, and his glutes don't fire as good as they should. This one's a really good one to get that to happen. Now,
you can tell Mike to turn more that way, so he's more straight.
it's okay. It's okay. Anyways, makes sense?
There we go.
Any questions with this one?
No.
The goal for this one is like Mike was just doing, to extend and bend, really gets those hamstrings firing, really challenges those areas, and he has to balance the whole time. My goal for this one is to get his arms to cross his chest so that you get the idea, but it'll really challenge your balance.
I'm going to use my elbows so
And
it looks like they're crossed.
that's when I'll know the patients are getting ready to be, say, game ready, because they can do this exercise and balance, and they don't need help with their arms, anything like that, and they can extend. The goal for this one is to go one leg. That's real tough. Come on up for me, Mike. That was a good challenge. That was a really good challenge.
So it's a good eccentric, advanced eccentric
there
exercise.
There you go. Very advanced. Yes, very
hamstrings.
tough exercise. Any of those exercises, to hold any one of them for a minute's a good challenge. He held that one for probably 3 or 4, which is fantastic. That's what I'm talking about when you're talking about an ideal patient, your model patient, which is exactly what we go for here at Elite Sports Medicine.
Mm-hmm. Well, thanks for your time. Go Comets.